Are you afraid of over-exercising on the chronic fatigue recovery journey, but you don't want to lose fitness? Here's how to move without crashing. So a very common fear for people that have fatigue-related conditions like ME, chronic fatigue, fibromyalgia, Lyme disease, long COVID, and so on, is the fear of over-exercising or the fear of exercising at all and then crashing. The first thing I want to say is it's a totally legitimate and valid fear. Indeed, one of the factors in how people become ill in the first place is pushing through the signals one's body is giving them. In many cases of fatigue-related conditions, people can look back on the months, even the years prior to crashing and see there were warning signs from their body, certainly when there's a gradual onset. In a sudden onset of the condition, it may not look quite like that. But we can see the warning signs we pushed through. And so now there is almost an allergic reaction to any time when we go beyond the capacities that we have. And then we end up with messages from mainstream medical practitioners saying to us, if you just do a bit more, you'll feel a bit better. And either intuitively, we just know that's wrong, or we try that advice and then we feel worse. But we don't want to lose fitness. And sometimes patients will say to us, well, should I start lifting weights and doing strength training? But this is someone that's having to go to bed for 2 hours every afternoon. The answer obviously is no. And yet there are also instances where as people start to move their bodies, they do start to feel better. In fact, sometimes you hear the stories where someone started to take up daily walking and gradually built their capacity and will say it was a turning point in their recovery. So how do we make sense of all of these experiences? Well, one of the big breakthroughs for us here at the Optimum Health Clinic was the recognition and the definition of 3 stages of recovery. And at certain stages, certain interventions can help make things better, but at other stages can make them worse. If we can recognize what stage of recovery you're at, that gives us an idea of how you can approach activity, exercise, physical movement, and so on. So just briefly, these stages are stage 1, the deep rest stage, otherwise known as the crash stage. It's in stage 1 that we need a lot of deep physical rest. Any kind of exercise at stage 1 where we're pushing a tool beyond our capacity is going to make things worse, not better. But as we come from stage 1 into stage 2, what we call tired but wired, energy starting to come back, but it's often going to the nervous system. One of the clues of the transition from stage 1 to stage 2 is actually we feel more anxious because our energy is now fueling that state of nervous system dysregulation or a feeling of anxiety. So one of the things that's critical at stage 2 is learning to calm and learning to regulate our nervous system. Then at stage 3, the reintegration stage, energy is coming back more and more, and then we're working how do we reintegrate back into the world. Now we can go through these stages on a micro level if we've gone through a mini crash and go through these stages over a few days or a few weeks. But often also these stages map the macro of our ongoing recovery journey. So if we come back to this idea of exercise, stage 1, any kind of exercise pushing beyond our capacity is going to make things worse. At stage 2, we have to be really careful not to do too much too quickly. Any kind of exercise may be walking, it may be swimming, it may be yoga, qigong, tai chi, pilates. We want to do exercise where we're really working to stay present and stay connected. So we can listen to our body. And if our body says, hang on, I'm running out of energy, we don't then flip into our stress hormones to keep us going, which is where we're likely to have a crash, a delayed fatigue response. At stage 3 of recovery, we can start to push these edges a little bit more. But the key thing is It's not our mind or an external practitioner saying, this is the plan that you need to follow. It's that each day we're building a little bit more energy than we're spending, but as we're recovering and we have more energy, we can start to use that energy more. And there's certainly a point that when one has enough basic energy to start to do more challenging exercise, often that will help the nervous system calm more. Like we move and then we can relax. And that movement can help discharge some of that tired and wired state. So to go back to the original question, can you exercise with fatigue-related conditions? The answer is no, and the answer is yes. Depends what stage you are, and what is critical is really listening to your body. And as you recover, your capacity is going to keep expanding, and as your capacity expands, then you can increase the amount of exercise that you do, the intensity, but also you can practice pushing past those edges because your body has the resilience to be able to recover from that. Let me know in the comments below this video, was this helpful? But also, what kinds of exercise have you been able to do and what do you find has helped you? Hope that's been helpful. Thank you for watching.